Officials have said over and over again, the virus doesn't discriminate.
It's mind-boggling, right? It doesn't make statistical sense.
You can see African Americans represent 41% of COVID-19 deaths.
In Louisiana, 70% of people killed by COVID-19 are black, even though they only represent 32% of the state's population.
I'll be honest with you. If it wasn't a conspiracy, it should have been.
Say a 65-year-old man goes to the ER today, a black man and a white man. They're both having a heart attack. The chances of the white man getting rushed into a cath lab to have a heart procedure done are higher than the black man. The black man, they'll say, "What did you take cocaine? Or what happened to you? Were you in a fight? Or what else is going on?" They'll try to find out the reason that might be causing him to have a heart attack instead of rushing him straight into the cath lab.
In order for my father to have discovered that he had 4 arteries blocked in his heart, I had to tell him to lie to the doctor so that they can do more testing.
People who don't have health insurance are walking around just praying that they don't get sick.
The lower income you are, the less likely you are to get the things you need, and the longer it takes.
Patients that grow up in rural areas, low-income patients, they don't get much health care or don't have the means and the funds to get the proper treatment that they should have.
Average lifespan for a regular man in Kenya, I think it's about 68 years old. And I think it's about 72 years old in this community.
The social determinants of health go unaddressed to our detriment. So food, transportation, public safety, public education, secondary education and beyond, all those things are health matters.
One of the problems with healthcare in the US is that it's simply not virtuous. It's designed to keep white people healthy. And if anybody gets any other benefit, they should count themselves lucky.
Doctors are taught to give disparate care. That's actually the correct answer on a lot of our standardized tests. So what you're feeling when you go to the doctor and you feel like you're being ignored, that's actually the right answer, believe it or not.
This has been going on for a long time, for decades. You could even argue as long as there have been African Americans in the United States. They have been subjected to institutional racism that affects their health.
The naive. They want to believe that this is all about coronavirus. But all COVID did was lay open a system of inequality that's been rampant for 402 years.
We have a lack of addressing people's needs when they do present to care. To me, that means we're not treating everyone equally.
If we don't have the right type of questions to ask and we're not talking to somebody that looks like us, then we don't always get the right type of care we need. That's reality.